So we are recording and give it a panel. All right. So this is true. You do need to know the most common drugs, especially those that increase the risk of any kind of injury or have an adverse effect like dizziness, orthostatic hypotension, etc. when combined with massage. Massage has a metabolic demand. It lowers blood sugar a little bit. It increases blood flow. It sometimes dilates, sometimes constricts, sometimes makes things hot. Right? There's the use of pressure, which is an issue for people who can't feel pain as much, like if they're taking some kind of pain reliever. Yeah, so there's a lot. And I just want you to be aware of the basic categories, and you can change some of the categories can change a little bit depending on how you look at it. I'll give one or two examples of that in a minute, but basically there's analgesics. A lot of them are over the counter. Some of them are prescription. Those are commonly called painkillers, right? Anti-inflammatory drugs, non-steroidal anti-inflammatory drugs. I'd like you to remember that. NSAIDs, muscle relaxers, antibiotics, diabetes management drugs, anticoagulants, antidepressants, anxiolytics. So that means something that reduces anxiety. And now we're going to go past all this stuff. Maybe I'll come back if we have time, come back to some of the more specific drugs, and we'll discuss some of that stuff if there's time. Okay, so this is from the AMTA, American Massage Therapy Association article, Massage and Medication. Here's the hyperlink for you guys if you want it. It's really, really great. So glad I found this. So let's see. Okay, and they organize it by disease type in one section of the article, and then by adverse effects in the next section of the article. So they start with, I'll just give you an overview. They start with arthritis, they go to diabetes, they go to Parkinson's, cardiovascular disease, which is as far as I've gotten so far. And then we're going to go through some of the questions. We're going to drill some questions. Okay, so arthritis. The most common way that arthritis is treated is through drugs. That is to say, Western medicine treats it for the most part with drugs. Massage therapists and acupuncturists, we treat it differently. We treat it through local stimulation, and we treat it through the systemic effects that we have on the body as well. The common drugs that are used are acetaminophen, tramadol, and narcotics. Those are all pain relievers. They also use NSAIDs, non-steroidal anti-inflammatory drugs, and anti-inflammatory reduces inflammation, reduces swelling. Remember that when there's inflammation, there is swelling. And when we say this is inflamed, what we mean is there is swelling, like water in there, right? Fluid in there. And there are steroids which reduce inflammation, like prednisone and cortisone, corticosteroids like prednisone and cortisone. And then there are non-steroids like ibuprofen and naproxen. Drugs like acetaminophen, they don't have an anti-inflammatory effect, neither do narcotics. They just lower the pain levels through different kinds of mechanisms. Sometimes they use disease-modifying anti-rheumatic or anti-rheumatic drugs. So rheumatism refers to a type of arthritis that's caused by the body's immune system breaking down its own tissues. It's an autoimmune condition, autoimmune disease, rheumatism. And they use disease-modifying anti-rheumatic drugs, DMARDs. I didn't come across many DMARDs in looking at the cautions and contraindications of massage with medications. I didn't see any DMARDs. And then biologics, I also didn't see these. People who take pain relievers, they have altered pain perception, right? So they don't really feel pain as much. They feel it, but not as much. They also can experience other effects which make them more vulnerable during a massage, like low blood pressure, dizziness, bleeding, and bruising. So low blood pressure would be relevant when someone, for example, if they're walking around, they constantly have low blood pressure. If they get on or off the table and they have low blood pressure, you would need to watch them closer than other patients, other clients, to make sure that they don't faint, pass out, fall, right? Get dizzy and lose their balance. Bleeding, bruising, you don't really want to like bruise somebody. You certainly don't want to like break the skin. So for someone who has bleeding or bruising, who's taking like non-steroidal anti-inflammatories or corticosteroids, I definitely wouldn't do cupping on people like that. Not if they're taking them long term. And if someone is at risk of bruising, I wouldn't be using like heavy pressure on them at all. So consider changing your treatment plan. That just means a little bit less pressure, a little bit less deep. On the MBLEx questions, you'll see the questions will be things like treat them normally, go extra deep, go just a little bit less deep than usual, right? So it's really kind of, I don't want to say common sense, but it's not going to be that tricky. It's also not that specific, right? It's also not like avoid tapotement, use effleurage. They don't get that specific when they ask about a patient who's taking pain relievers. Okay, people who take corticosteroids can have swelling of the legs, thinning of the skin, tendency to bruise, high blood pressure, weakened immune response, osteoporosis if they've been using it long term, which puts them at increased risk for bone fractures. So corticosteroids, you probably know that they suppress the body's immune response, right? Swelling, inflammation, those are a result of the immune response. So if you slow down the immune system, you slow down the repair of the whole body, not just like the places where there's rheumatoid arthritis or the places where there's osteoarthritis. You slow down everything, including the repair of the skin, right? The remodeling, the repair of the bones. So over time, you can see changes in people who are taking corticosteroids long term that you would not see in someone who's taking something like acetaminophen long term. In my opinion, or NSAIDs long term. I don't think any of this stuff is good, but corticosteroids compared to NSAIDs and acetaminophen, corticosteroids are like much heavier. So someone has increased risk of bone fractures if they're taking corticosteroids. Three things you should consider. So deep tissue work, try to avoid deep tissue work. And then use more gentle strokes instead of deep tissue work. You can get a lot of effect, you can get a lot done not using deep tissue work, using gentler strokes on the surface, middle to upper surfaces of the body. You can get quite a lot of relief that way. If they're taking the medications through injection, like if they're getting steroid injections, don't work over the site of the injection, because the injection site is a little more prone to weakening of the tissues, including the bones in that area. You may have heard that doctors will not give more than X number of corticosteroid injections in one specific place or, in someone's whole life. The number used to be 3, now it's 6. You probably tell I feel very skeptical about or cynical about that, or both. Anyhow, any questions about corticosteroids? All right. That was for arthritis, right? Corticosteroids are used in more than just arthritis. They may be used in people who have, they're sometimes used in people who get things like concussion, which has swelling. They're used with anything where there's swelling and inflammation, like it could be used in certainly allergic responses. They're like miracle, prednisone, miracle for someone who's like airways are starting to swell up because they ate something or they got stung or something like that. Yeah, but sometimes you see it being used to try to calm down a flare up of rheumatoid arthritis or some kind of flare up of an allergy that's present for a long period of time. You know, I can't say that I agree with that approach. But anyway, diabetes. Diabetes is caused by too little insulin in the blood or the inability of the body to use insulin. And there are two types. Type 1 is commonly referred to as childhood. So this means people who cannot manufacture insulin, they're insulin dependent. That's what you need to remember about type 1. They're insulin dependent. They have to take insulin. And then type 2 is adult onset. And adult onset diabetes usually happens as a result of diet, but a predisposition, you know, you could say a genetic predisposition towards having diabetes. And some people, they acquire type 2 diabetes and they take medication for the rest of their lives for it. And other people, they reverse it through diet. Okay, the medications for that include insulin injections, or metformin. And when you see these capital letters on terms next to the description of medications or categories of medications, realize that those are brand names. So what you really need to remember are insulin and metformin. Metformin, I believe, is a glucophage. Metformin, I believe, is called glucophage or Glumetza, depending on the manufacturer. And then there's thiazolidinediones, and those go under the brand. Those are made under the brand name Actos and Avandia. You may remember about 15 years ago there was an enormous lawsuit regarding Avandia. I don't remember what happened. I just remember that like Avandia turned out to be really bad news, and a bunch of people sued. Okay, side effects of diabetes medications. Side effects of diabetes medications, and there's nothing listed there. Okay, well, I'll just tell you. 1 second. Let me pause the recording so I can. Zoom recording. Meeting controls. Nope. That's it. Oh, well, how that happened. All right. Okay, so some of the side effects will be down here among the recommendations, which is good. It's more direct for you guys. So the recommendations for massage therapists are, if someone has diabetes, always get a physician's referral for massage. Always get a physician's referral for massage. Now that's for the MBLEx test. In real life, what do you do if somebody says, if somebody comes in and they're like 70 years old and like, you know, they've been there and back in the world and they're just like, you know, look, I don't know, I don't have time to get a physician's massage. I don't care about getting a physician's massage. They're right there in front of you. They're like, you gonna work on me or not? That's like a tough choice, right? You better know what questions to ask, right? Are you prone to dizziness, orthostatic hypotension? Do you get lightheaded easily? When's the last time you ate? How is your blood sugar? Did you check your blood sugar before you came in? Do you have anything with you to eat? Have you been taking your insulin or your Avandia or whatever regularly? So recommendation is to get a physician's referral for massage. And then to start with shorter sessions to see how they're going to react, to see how the therapy affects your client's diabetes symptoms, and the medication side effects. This is a good recommendation, I thought. So when you schedule massages, do so during peak availability of the medications, right? So that means make sure that your client has the medication available, that it's not, like at the end of their course of insulin before they have to renew. Make sure that they have their medications with them. And also make sure that it's around the time that they would take their medication, because that'll help to mitigate any symptoms that might happen. For diabetes, that's things that look like hypoglycemia or hypoglycemic shock. Also, make sure your client has eaten prior to the session. That can help a lot. That should be for everybody. I tell people that acupuncture and body work lower your blood sugar, so you have to make sure that you've eaten adequately that day. Make sure that you eat well before your appointment. I find that if I get too specific, people are like, well, how many hours before should I eat? What should I have to eat? How should I feel? And even the Chinese have sayings about that. Acupuncture, not while full, not while hungry. But if you just tell them, don't skip any meals, make sure that your blood sugar is going to be stable, it will lower your blood sugar. Usually they get it, they know how to take care of themselves. And look for any wounds. Why wounds? Well, with diabetes, diabetics are prone to a few things. First, they're prone to neuropathy, which means either abnormal sensations in the periphery, like in the hands, fingers, feet, toes, or it can mean necrosis in the hands, fingers, feet, and toes. Diabetics sometimes have to have amputations because the blood flow to their extremities is not adequate. But they're also vulnerable to the skin breaking down. So they get openings, they get sores, they get lesions. And if someone has a wound, that's a local contraindication. Like, you don't work on the wound, you don't work around the sore, but you can still work on the limb. But you have to be easy with the limb, right? Because the blood flow and the skin are not the same. And someone who's a diabetic who is an athlete is at one end of the spectrum, and someone who's a diabetic who's sedentary and 60 or 70 is at the other end of the spectrum. That person is much more vulnerable, much less resilient than the athlete. There are lots of people who are diabetic who are just strong AF, but not everybody's going to be like not everybody's going to have like skin breakdown and peripheral neuropathy and stuff like that. Ask whether your client is experiencing any sensory loss or alterations. So that means, are they having any like hearing or vision disturbances? Are they perceiving things correctly? Is their balance all right? All those things. Can they feel normally? And then tingling or numbness. Tingling or numbness is kind of like sensory alterations. Those are called abnormal sensations or paresthesia, abnormal feelings. Tingling or numbness is definitely a warning sign. If somebody has that and they don't usually, that means that something has changed, right? And you need to tell them, follow up with your doctor. You're having tingling or numbness, go ask about diabetic neuropathy, right? Like, it could be compression in their spine, along the spinal column. It could be from really tight muscles or swelling or something like that. It might be piriformis syndrome, upper trap, trapezius, trigger points, whatever. It might also be changes in blood flow and lack of nourishment to the nerves. And that is, those are two different problems and really need to be followed up on. There's really never any harm in following up, never any harm in getting a diagnosis. Leg cramps. Leg cramps are almost always a caution, not just because they're prone to neuropathy, prone to vascular changes in the limbs, but also because leg cramps in anyone who doesn't usually get leg cramps, or who can't be easily explained by a running routine and a change in diet that deprives someone of something like magnesium or calcium. if there's an explanation like that, or if they've been prone to them all their life, then you don't have to be quite so cautious. But if someone has leg cramps, some good questions for them might be, well, are you taking blood thinners? Did you travel on an airplane recently? Any like changes in altitude like that? You're looking for a DVT, deep vein thrombosis kind of thing, right? And you definitely don't want to be pressing on that. And then fatigue and muscle weakness, those go along with diabetic neuropathy. Okay. Okay, continuation of diabetes. So hypoglycemia, hypo means below, hyper means above. So glycemia refers to glucose. So lower than normal glucose levels in the blood, also known as insulin shock, can be life-threatening. And it sure feels when you're hypoglycemic, it sure feels like it's life-threatening. You can be almost completely non-functional. It's so severe that the US military is experimenting with low carbohydrate rations, high fat rations, things that will keep soldiers away from hypoglycemia for longer, because hypoglycemia can just debilitate, like incapacitate someone. Dizziness, weakness, sweating, rapid heartbeat, severe anxiety, panic, rapid breathing, can look like a panic attack, can look like a heart attack. Right? Always ask clients to check their blood sugar levels prior to the massage. That was one of the suggestions up here. Yeah, has your client eaten prior to the session? Ask them to check their blood sugar levels prior to the massage. Diabetics who are good at maintaining their glycemic levels, they usually travel with some kind of blood sugar monitor. It's just a machine. They have a lancet, they prick their finger. Sometimes they don't do that. I don't know how that works, but if they use like a blood sample, they have a little machine, they prick their finger, they have a little test strip piece of paper that absorbs the blood, they stick it in the machine, and the machine tells them where their blood sugar is at. Insulin dependent clients should always have a source of sugar available. So, in like the worst setting, that's like a bag of gummy worms, or like a roll of lifesavers, or some crap like that. In the best scenario, they've got like a bag of nuts, or some almond butter. They might have beef jerky or something high protein of that nature, or they might just have like an extra muffin, or a bagel or whatever on them. It's not a bad idea for you to keep fruit juice or regular soda with sugar in it on hand. I would keep, just as a personal choice, I would keep something like fruit, like quick digesting, high sugar fruit around, like maybe raisins, or a banana, and give somebody something like that over fruit juice or soda. But you do what you think is best for your client and for your clinic. Clients who take a combination of diabetes medications and other drugs, you have to watch out for them because they're at higher risk of hypoglycemia. Right? Those include NSAIDs. They might be taking those because they tend to have swelling in the limbs. Right? Aspirin they may be taking because people who are diabetic sometimes have a comorbidity, or like concurrent occurrence of things like cardiovascular disease. Right? And cardiovascular disease is the #1 killer of adults in the United States. Cardiovascular disease is the #1 cause of death of adults in the United States. Children in the United States, it's accidents, which includes gunshots. Crazy is that? Which is crazier?
So
Which one's crazier?
if someone is taking diabetic meds and other drugs, is it best to just have them talk to a physician first, or do we just avoid it, or what?
Sade, your volume is pretty low. what I heard was if someone is taking diabetes medication and then I missed the second medication. What's the second medication? Any of these?
Yeah.
Okay. No, you don't have to have that consult with a doctor or get a referral from a doctor solely for that. You should have someone who's diabetic get a referral for a massage from a doctor. And generally when the doctor gives you a referral, it'll be for a series of massages, or it'll just be for massage, right? Like it'll be for like, 6 massages, 10 massages, or it'll be for the duration of the person's policy that calendar year or that term. So that's just a thing you should do for people who are diabetic. If they're on a diabetes medication and they're taking other drugs, they're more at risk for hypoglycemia. So you have to be even more vigilant. Like you can't let people come in and say, you can't let people come in who haven't eaten in like 4 hours, right? You can't let people who are taking multiple medications, one of which is for diabetes, you can't let them not test their blood sugar within like 6 hours, 10 hours, whatever you think is reasonable. Right? You can't let them come in and not have something like fruit juice on hand, and you have to watch them a little bit more carefully because since they're at risk of hypoglycemia, if they suddenly get dizzy, if they get orthostatic hypotension and they start to change position on the table or they get up from the table and they fall, then they could be really seriously injured. Does that make sense? So, okay, now Parkinson's disease. So drugs used to treat Parkinson's disease include parasympatholytics, parasympathetic nervous system, parasympatholytics. Those are the ones that control so they replace neurotransmitters such as dopamine or increase neurotransmitters such as dopamine, which are part of the parasympathetic nervous system response. That's the best I can explain it. Oh, and dopaminergics. And the most common one is levodopa, also called dopar, lorodopa, ledopa. With people who have Parkinson's disease, they're also prone to dizziness, also disorientation, right? They can get drowsy, disoriented, wake up and not know where they are. How many people does that happen to, like in the last few minutes of the massage or acupuncture or craniosacral? Low blood pressure, especially when changing position, very important that you keep an eye on those people when they're changing position or when they're getting up. To help the muscles relax, try using effleurage and rocking strokes and possibly some petrissage, right? Try to avoid things like, oh no, actually it's, no, I'm confused. I'm sorry. I'm thinking of some other disease where we avoid trigger point release and other things. No, I'm sorry. To help muscles relax, try using effleurage and rocking strokes, possibly petrissage. If the client is too relaxed or sedated, use stimulating strokes towards the end of the massage, like tapotement or fast effleurage. If your client is dizzy, drowsy, or disoriented, offer to help him or her get up from the table. Right? Very important to watch like that. Okay. And then this is for cardiovascular disease. Very sad. Leading cause of death in men and women. How can this be? Coronary artery disease, heart failure, vascular diseases of the blood vessels, heart valve disease, and other diseases of heart. Some of those are congenital, some of those you may have a hereditary tendency, but most of this can be avoided through diet and through some kind of regular movement where the heart is put under regular stress. I don't like the word exercise because, like diet, it has comes with like this connotation of pressure. People hear that and they're like, oh, I always fail at that. Some common medications that can cause easy bruising. Okay, I guess I should back up. So for cardiovascular disease, one of the things that is usually prescribed is something that prevents a blood clot. Those can be two kinds of medications. It can be what is called a clotting, anti-clotting medication, anticoagulant, right? Or a blood regulator. An anticoagulant is a type of blood regulator. A platelet aggregation inhibitor is another type of blood regulator. You don't really need to know this. I just want you to have some like framing for it. So one approach to prolonging someone's life, preventing a heart attack, preventing a stroke, preventing thrombosis, is to prevent the formation of a clot. So those are drugs like warfarin, which is also the same as Coumadin. That's a type of blood thinner, but it prevents clotting. It works under the mechanism of inhibiting the formation of a clot. So that's one kind of blood regulator. Another kind of blood regulator is aspirin, and aspirin prevents the formation of platelets. And aspirin is pretty mild on the scale, like compared to Coumadin or warfarin is pretty mild. So yeah, different from preventing clotting, aspirin prevents the formation of platelets. It's also a salicylate or salicylic acid. You find salicylic acid in some topical stuff, like if you use Tiger Balm or Icy Hot or UI oil or 701 patches or any of those things which are from Thailand or China or the United States or Europe. Oftentimes they'll dose it up with like salicylic acid. Why? Because it moves blood and it relieves pain. And people feel better, and then they use the product more and they buy the product more. So we'll go over like the stuff about aspirin in a minute, but in someone who has cardiovascular disease, who has a cardiovascular history, they're probably taking something that makes their blood thinner than most people. That means they bruise easily, and that means that if you pierce the skin, they can bleed more easily. They can bruise, and it also means that if you use something like cups or Graston technique or gua sha or rubbing, it means also that the bruising may be more severe. I've seen in people who are diabetic and who are older, like 60 and up, people who are diabetic or people who have a cardiovascular history, I've seen that if I put cups on them, it actually causes blisters, very small blisters on the skin. Yeah, and it's just once you have cardiovascular history, once you have lived with diabetes long enough, the skin is just really sensitive. It's thin. It's just not the same. Okay, I should move on. I'm sorry. Before I start telling like clinic stories, sorry. So they commonly take anticoagulants, which we've talked about. So that's Coumadin, warfarin, salicylates, aspirin. They also may be taking non-steroidal anti-inflammatory drugs, NSAIDs, aspirin, and then corticosteroids they sometimes can take. So it's either NSAIDs or corticosteroids that are given to reduce inflammation. It's either anticoagulants like warfarin and Coumadin or aspirin that are given to thin the blood to prevent stroke, myocardial infarction, etc. Depends on the doctor. I have seen people who take both of them. They take like a baby aspirin every day, and they also take Coumadin. Okay, so let's go back up to, before we start the questions, let's go back up to, let's finish off with aspirin, and then I'll take the temperature on the class and see how you guys feel about like which way you want to go, all right? So, so aspirin is also used not just for cardiovascular disease maintenance prevention, but also for pain, also to reduce fever, and generally to reduce inflammation. Aspirin for these purposes is used shorter term generally, unless the person has arthritis, in which case they may be taking aspirin. They may also be taking something like Tylenol, which is a different kind of pain reliever. And then, yeah, so it's for maintenance and prevention in someone who has cardiovascular history, that's a stroke. And MI stands for myocardial, muscle of the heart. Infarction, which I think means starvation of oxygen due to clotting, or starvation of oxygen of the muscle of the heart. Angina, which is also deprivation of oxygen and blood flow to the muscle around the heart. That's like extreme pain that happens and can be a precursor or a warning sign of heart attack. And then relevant for massage therapists, when someone comes in and they've been taking aspirin, regardless of what it is for, know that their blood is thinner and that they clot slower, not as much as other people who aren't taking aspirin. You might find someone who's taking aspirin, like a lot of aspirin, because the ibuprofen that they were taking for their arthritis started irritating their stomach, or because their doctor told them to take aspirin rather than Tylenol, and allergic to Tylenol, which is acetaminophen. So for them, it's important that you avoid deep tissue massage. You have to use things like kneading. No, I'm sorry. You have to use techniques like gentle compression, friction, and petrissage. Avoid techniques like deep kneading. Avoid muscle stripping. Avoid trigger point compressions. Okay, so now we have a couple choices. So we can either go through some of the broader statistics collected by the CDC on medications, like what medications are most commonly given, what age, how many people, racial demographics, types of medications by year, by age, what are the categories, and then we can talk a little bit about the ones we haven't talked about, which are analgesics. Which is just analgesics. We talked about platelet aggregation inhibitor, really just aspirin. Do you guys want to go through these other 3 slides, which are like very information dense, or would you rather go on and start drilling some questions? Raise your hand if you want to drill questions. Like visibly raise your hand if you want to drill questions. Okay, nobody? Wow. And just so I'm not hallucinating. Oh, you want to drill questions? Okay. And now raise your hand if you want to do the deeper dive information about medications. Okay. So we need a tiebreaker. Larissa, you want to do the deeper dive stuff?
Yes. Sorry, my camera's not working. I'm on my phone, so.
Nah, that's all good. It's all good. Okay. So when you take the MBLEx, it's really about what are like the most risky interactions. What are the conditions? What are the drugs which increase risks? Think of someone's body while they're taking a medication as being different from what you would expect from, a normal healthy person who may be athletic or semi-athletic, right? Very different from the from the unmedicated client, the unmedicated patient. The person on medication, their nervous system may operate differently. So they may have perceptions of pain or other sensations that are different. They may not have the same kind of balance that unmedicated patients have. They may not have the same tolerance for stimulation, right? They may not have the same tolerance for anxiety or stress. They may not have the same tolerance for sound. They may get cold more easily if they're taking Coumadin or warfarin, for example. They may not be able to retain their body heat. They may be prone to, we mentioned all this stuff like bruising and bleeding and hypoglycemia, orthostatic hypotension, right? Slow wound healing, sensations of numbness and tingling in the extremities, muscle tightness, lower back pain. What does that sound like? I have lower back pain and muscle tension in that area, and I have numbness and tingling in my feet. What does that sound like?
It's
Fast.
Hypoglycemia.
Yeah. Hypoglycemia? No, I
Oh,
wouldn't
I'm
say
sorry. Nah.
hypoglycemia.
All right.
I
I
would
was
I would say
I said that just because you know how you said that, like sometimes with like, you know, when you're low, when your sugar pressure is low, it kind of just feels like, you know, you're losing feeling. But I mean, it's a heart attack or
a heart attack would be similar sensations in the arm, specifically the left arm and
okay, okay,
chest. But if
okay,
somebody says I have like low back pain and the muscles
right,
back there are really tight, and I'm having some numbness and tingling in the feet, that can be a side effect of a medication. It might also be someone's that might also be a result of diabetes.
mhm,
But it also sounds like low back tension with nerve root compression,
okay,
right? It sounds like radiculopathy or paresthesia, numbness and tingling, referred pain into the lower limb
mhm,
as a result of what's happening around the nerve roots, herniated disc, bulging disc, or just joint misalignment with a lot of compression, arthritis in the spine, chronic muscle tension. It happens with that too. Piriformis
right.
syndrome, right?
You know,
So,
I just wanted to throw something out there as well. And the reason I kind of, because they also say that like if you feel like some type of tingling in the arm or something like that, I think it's like the right arm or something is probably like liver, like dysfunction, something happening in the liver. You know what I mean? Like sometimes they say that like when you feel certain tingling sensations and in the body, you know, it could be probably a system that might be not functioning properly or something like that. So,
yeah. Well, I don't know, like I'm not aware of any liver related numbness and tingling in the arms, like in the right arm.
okay.
That may be the case. I certainly do not know everything, all the
Mhm.
symptoms and stuff, but those are called visceral sensations, by the
Right,
way,
right. Yeah,
or
yeah.
visceral, yeah, like visceral pain or visceral referred symptoms. But I do know that on the left side, that's related to the heart. If it's the tip of the shoulder, commonly I think it's the right shoulder, that can be an indication of some kind of gallbladder pathology. Um, I don't know a lot about that. I would have to look it up. We should look at those anyway, because I think there's like going to be one or two questions on the index about that, like what kind of, what does this pain distribution pattern look like? Does it look like the liver, the ovaries, the gallbladder, the spleen? Okay, so categories of medications: over the counter, OTC, and prescription analgesics. So A is negative, not away from, and ANA is negative, not away from, and Gesics is pain, right? So painkillers or away from pain, and um, those can be medications like acetaminophen, right, which is known as Tylenol. For the most part, it's Tylenol, but acetaminophen is also found in a lot of other, is also combined with other drugs, right? So in NyQuil or DayQuil, acetaminophen may be combined with a decongestant, for example, right? In something like Excedrin or Alka-Seltzer Plus, it may be combined with other things. Um, where am I going with that? I remember I thought it was important. Oh yeah, analgesics can be more than acetaminophen. They can be more than Tylenol. Um, although not classified as such. Oh, okay, let me back up. Analgesics can be more than acetaminophen. They can include opioids, right? They also can include also drugs that are not meant to be analgesics can be used as analgesics, like aspirin can be used as an analgesic, or people can use NSAIDs or muscle relaxers in order to reduce pain, right? And that can be perceived sometimes by the client and by the practitioner as a kind of analgesia. But when someone says analgesic, generally they mean one of three things. They mean like um, acetaminophen, or they mean ibuprofen, which is actually a non-steroidal anti-inflammatory drug, or they mean some kind of opioid. Okay, anti-inflammatory drugs, NSAIDs. Very important that you remember NSAIDs. It should be lowercase s here. NSAIDs are overused, and NSAIDs in studies outside the United States, where the studies are not sponsored by the pharmaceutical industry, have been shown to prolong the healing time of the conditions for which they are used, especially for myofascial injury, myofascial conditions, musculoskeletal injuries. And then muscle relaxers, muscle relaxers, antibiotics, there should be a T there, antibiotics. Diabetes management drugs, we went over like Bandia. Anticoagulants, we talked a little bit about those. Antidepressants and anxiolytics. So I'll talk more about these next time, or maybe I'll just get like some questions and some information together and just send you a text message saying, hey, there's more information available about this. Please check it out. And if you don't, let me know before the end of the series and we'll go over it. Maybe I'll do that. We'll see. But I do want to say that when someone is taking, if you find that your client is taking antidepressants or anxiolytics, you have to have your like feelers up, be paying attention more for things like panic, or for the perception of things that are a threat or that are wrong, right? Like people who have stuff happening in their body, like low back pain or you know, tendonitis or whatever, that we consider to be like entirely treatable and not that pathological, their minds, especially if they're prone to anxiety, if they're prone to depression, their minds will go places that you may not anticipate. So just be aware of that it's, and a lot of them will come to you as a massage therapist as the last stop before surgery, which is like, you know, surgery is like mentally, emotionally, spiritually an extremely big deal. So on the precipice of something like that, someone with a history of, you know, emotional distortion that's difficult for them to handle, such that they need some kind of pharmaceutical mitigation, just, you know, be more sensitive to that person. And I would say really keep things simple and be sure to communicate and consistently, like really consistently check in. How are you doing? How are you feeling? Is this too much? Please let me know if anything is too much, right? Just being a good communicator will you handle most of that. I did have a guy once though, he hadn't moved his shoulder, like really moved his shoulder in a long time because he could feel it was freezing. And this is like my first year of practice, and I was doing a lot of body work, a lot of Tuina, did acupuncture on him, then I did Tuina, and then I did what's called the drawer test, just where I moved the head of the humerus forward and back a little bit, just to see how much play there was in the joint, if it had loosened it at all. And there were significant like calcium deposits in his shoulder, and he didn't know that, and I didn't know that, and he heard the sound and he panicked, and he insisted that I call an ambulance. So once somebody starts that and they say, you know, I need you to call an ambulance, if you say no, you're standing in the way of them getting a medical care on a level that's like, on the plus side, once you refer somebody to the emergency department, it's in their hands legally, and their hands are the best to help the person. But I got in the ambulance with him. I rode with him. The whole situation was like out of control. I got there, his primary care physician showed up, and turns out the PCP was kind of like not, let's just say, not being helpful for the guy's mental processes around his body. And in the end, everything was better because he got a CT, and the radiologist said, okay, this is really advanced degeneration in your shoulder. We recommend that you have surgery. And he got the surgery that he needed, and then he got his shoulder back. In the meantime, I was like in the middle of this, you know, storm, trying to help that guy. And the one thing that could have prevented me from that is the question, are you taking any medications? Because he was taking Klonopin, which is an anxiolytic. And if I had found out that he had taken Klonopin, I wouldn't have been so aggressive with his shoulder. I would have just been like, we're just going to do a little light acupuncture and that's it. And we'll see how you do. You know, we're going to keep it shorter this time. We'll do a little longer next time. Let's see what happens. By the way, I want you to see a physician about your shoulder in the meantime. Are you taking any medications? I was in a hurry that night and I didn't ask him. Never made that mistake again. Okay, a lot of people take medications, and the older the population gets, the more likely they are taking medications. 85% of adults age 60 and over, they take medications, but plenty of children take medications. And if you look at what people are taking, between 0 and 11 years, the number one thing that people take are bronchodilators. That's for asthma. Second to that is central nervous system stimulants, attention deficit for attention deficit disorder, ADD, ADHD. And then, you know, antibiotics, penicillins for infection, you have to take those. And then for 12 to 19 years, it's oral contraceptives, still central nervous system disorders, that goes up. And then asthma takes second place. And then you start to see cardiovascular disease playing out in the 20 to 59 year range, right? It's lipid lowering drugs and antidepressants. And then over 60, it's diabetes, and then it's cardiovascular disease, right? High blood pressure, beta blockers for high blood pressure and heart disease, lipid lowering drugs, and then anti-diabetic drugs. Seems the title here. No. Okay. What types of medication would affect a client most during massage treatment? Let's just look at this for a second. Analgesics, anticoagulants, methacostatism, systemic hypertension. Yeah, no. This is incomplete. Incomplete. Classes of medication, we already covered that. There's some things here like antipsychotics. I don't think you're going to need to know those. This is really just so you can get an idea of what people are taking. So you've heard this stuff, right? So when you hear ACE inhibitor, you know that it's for some kind of cardiovascular disease, diuretics or for cardiovascular disease, not for, you know, to keep someone peeing or to make someone pee. Okay. And then we went over non-opioid analgesics. So now it's time to go over some questions. And the questions I'm going to use in a format, I'm going to use a different format tonight. It's going to be PDF. That way we can zoom in and zoom out much more easily. You guys want to do a few questions and then take a break, or take a break now and come back and do the questions? Take a break now, hold your hand up, please. Do the questions, hold your hand up. Okay, okay. I'll assume you all want to do the questions. And we can do this. Sorry. All right. Let's go. This is from the AMTA app. I just went through this section, which is contraindications. Let me get you the exact title of the section. So the section that I used, if you want to drill this on your own, is under build quiz. Under build your own quiz. The section that I used was pathology, contraindications, areas of caution, and special populations. Okay, so when massaging a client with osteoporosis, the massage therapist must exercise caution during the use of techniques that cause therapeutic inflammation, the use of compressive forces, scalp massage, or relaxation techniques. Techniques that cause therapeutic inflammation, compressive forces, scalp massage, or relaxation techniques. And okay, and the answer is apparently I don't know how to use a computer. The answer is the use of compressive forces. And why is that relevant to medications? The reason is because osteoporosis is a result of some medications long term. Also, people can just have it genetically, but there is one medication or one category of medications that causes osteoporosis if you use long term. Do you guys remember what category that is? One
Sorry,
of you knows.
what was the question? I'm sorry.
The question is okay, osteoporosis is caused by one category of medications if taken long term. What's the name of the category? Which category? The brand name is prednisone. What category is prednisone?
So that medication causes osteoporosis?
Yeah, if used
Really?
long term.
Oh, wow.
Mhm.
It
But
weakens
it's
the
part of a
bone.
That's right. That's right.
Yeah.
So if someone is having prednisone, if they're getting a prednisone injection or if they're taking oral prednisone long term, some of the recommendations are don't work over the site of the injection because the tissue there can be degraded, can be broken down. But also, if they're taking it long term, the bones throughout the whole body might be porous, might be weaker. So you can't use things like compressive forces with the same kind of certainty that you can
Oh, okay.
with someone who is not medicated. And that category is corticosteroids. So that's steroids that are produced by the cortex of the adrenal glands. We haven't looked at the endocrine system. Maybe we should do that. Okay, let's see. 233 of, yeah. A client is on Ritalin, which is a client is on Ritalin, which is an amphetamine. She is most likely being treated for a nervous system disorder, a respiratory system disorder, a cardiovascular system disorder, or a reproductive system disorder. What do you guys think? Ritalin, which is an amphetamine.
Nervous system?
Yeah, that's right. Just a second. Yep. And the answer is definitely a nervous system disorder. And let's see if we get the explanation. No, there's no explanation. So Ritalin as an amphetamine is often used to treat ADHD, which is I prefer the term neurodivergent or neuroatypical or ADHD brain rather than nervous system disorder. But that's because I have ADHD, which is why I'm still talking about myself in your class. Okay, slide 5 of 52. Okay, of the following options, which one does not require a physician's referral? Which condition does not require a referral from a medical doctor? Warm, tender, hard veins, a pulse over 90 beats per minute, a pulse below 90 beats per minute, or respiration rate of 15 breaths per minute. Which one does not require a physician's referral? Well, warm, tender, and hard veins, that can be some kind of sclerosis. It could be an infection. I've seen that before. It could be related to a DVT, some kind of diabetic neuropathy. So if they haven't had that checked out, do not touch it and have them see a physician. And don't work on the person at all. Just say, go see a physician and come back, and then we'll make a plan for you in which we don't work on that spot, but we work on other stuff. A pulse over 90 beats per minute, that's pretty fast. It's pretty fast. Pulse below 60 beats per minute. Well, for the purposes of the test, let's just say that that's correct. All right. You get athletes all the time whose pulse is 50 beats per minute, and it's no problem. But And that leaves this one a respiration rate of 15 breaths per minute. And I missed this one actually when I was taking it. So the normal rate of respiration is between 12 and 20. Let's figure so you can see it. Normal respiratory rate is between 12 and 20 breaths per minute. So 15 breaths per minute is well within a normal range. A pulse over 90 beats per minute or below 60 beats per minute are both well outside the normal range, and therefore indicate some kind of dysfunction of the circulatory system. Not in reality, but on the test yet. Either one is an indication for a physician referral. Warm, tender, hard veins are also an indication for a referral, since these signs may indicate a deep vein thrombosis or an infectious process.
Hey, Kim, quick question.
Yes, yes.
So it says a pulse over 90 beats per minute or below 60 beats per minute are outside normal range. I mean, what would be the normal range then? I mean, just for like quiz taking purposes.
Oh, for respiration?
Yeah. Or like the beats.
We have to.
Right, they said the beats, the heart, a pulse over 90 beats, like the heart. Is it
Yeah.
talking about the heartbeat?
Yes, yes, it is. We should look that up.
Oh, okay.
Okay, let's see. Normal minutes for pulse. Normal resting heart rate is from 60 to 100 beats per minute. That's from the Mayo Clinic.
Okay.
Let's see. What's the MBLEx? If we put in MBLEx, yeah. Let's see. Normal limits for pulse MBLEx. What's considered passing? That's like the first thing that comes up for the MBLEx, no matter what you put it in. Okay, so between 60 and 100 beats per minute. I mean, I've never seen anyone who has a pulse that high, 90. I've never seen anyone who has a pulse that high as their resting heart rate. I've seen 80 or between 80 and 85, but 90, I don't think I've ever actually seen that. It is a good idea to take your client's pulse. Why not? You can take it in 3 places, and that'll actually rule out some things. I mean, you are a healthcare provider, no matter what anybody says, caring for somebody's health. You can take it at the carotid artery, and then at the radial. I'm just making sure my dog's okay because I heard some big noise there. I'm sorry. Or at the radial artery at the wrist. Another place is the dorsal pectoralis. So there's a pulse right here at the top of the foot. And I did hear a story once. About from a friend who's a chiropractor about he was in the routine of just taking these pulses, and he couldn't find the pulse at the foot, and they did find a vascular problem in the leg that the client was not aware of. I don't remember what it was, but in 20 years I've heard a story like that one time. I don't think you're going to run up against that, but just as a matter of routine, you could take the pulse in a couple places. It'd be all right. So between 60 and 90, or 60, between 60 and 90 is okay. 90 and above, below 60, pathological. Let's see. Yeah. Okay. Okay, which of these is a contraindication? Now, what is a contraindication? A condition in which there is no benefit or harmful indication, a condition for which massage would be beneficial, general relaxation massage for pleasure, a condition for which an approach could be harmful. And that's a little bit, yeah, and the answer is a condition for which an approach could be harmful. So when they say an approach, when they say an approach in this context, what they mean is some kind of application, some kind of therapeutic application. I don't know why they use that phrasing. Which of the following drugs impacts the central nervous system and acts as a depressant? Which of the following impacts the central nervous system and acts as a depressant. Well, I don't know if you're aware, but all four of these, cocaine, nicotine, amphetamines, and narcotics, they all impact the central nervous system. But only one is a depressant, considered also a depressant, and those are narcotics. Cocaine, amphetamines, it's definitely a depressant. If you get arrested with those on you, you're going to be depressed. But they're not actually a depressant themselves. Okay, narcotics. So we use narcotics just to mean like, you know, a classification, a legal classification of drugs. I don't know if you're aware of that. Like weed is considered a narcotic, whatever. Drugs influence the central nervous system with a variety of effects. That's what we've been talking about. Examples are stimulants that include caffeine, nicotine, amphetamines, and cocaine. Depressants include alcohol, narcotics, tranquilizers, barbiturates, hallucinogens or LSD, PCP, and marijuana. Anyway, a regular client comes in for their monthly massage. When they arrive, oh, let me just back up. So marijuana at one point was classified as a narcotic. Anyway. Okay, a regular client comes in for their monthly massage. When they arrive, they say, I'm so excited for this. I have flu and I've had a fever for days. I'm so glad I finally get to have a massage and relax. I know this is going to help. How should the therapist proceed? Proceed with the massage using only long gliding strokes. Proceed with the massage. Proceed with the massage, but use only deep pressure instead of long gliding strokes, or reschedule the session. What do you guys think?
Reschedule.
Reschedule the session.
Definitely, definitely. Do you charge the person for not canceling within 24 hours?
I don't know.
Marcos, come on, come
know, right?
on.
I'm just kidding.
Yeah, right. You know, it's all about disease transmission, right? A fever is a general contraindication anyway. So if somebody has a fever, better not to work on them. Massage increases circulation and also temporarily increases inflammation. Fever is a form of systemic inflammation. Massage will likely worsen the condition in some way. In addition to this, working on a client with a contagious illness poses a risk to the massage therapist and everybody else. Yeah. Okay, in a very busy clinic, a new client arrives 15 minutes late to his appointment. Rushed, the therapist begins the session quickly without spending much time talking with the client about his health history. After the session, the client calls to tell the therapist he has a rash along his back and is on his way to the hospital. Which of the following is the most important step that the therapist should have done differently? Ask the client if he's had a massage before. Ask the client about any allergies prior to treatment. Turn the client away for arriving late. Ask the client about his feelings towards massage. What do you guys think?
Ask about allergies prior to,
Definitely.
even though I feel like Marcos would say, like, you know.
Yeah, right?
Marcos would be like, I'm not talking to you until you pay me. Oh, you got allergies? No, you can't be treated. Later. No, I'm teasing Marcos. That's what I would do. Not do. Okay. So a massage therapist notices an open sore on a client's right thigh. When she asks about it, the client says it was caused by a recent bicycle accident in which they sustained no other injuries. There are no signs of infection. What is the most appropriate action for the massage therapist to take? Avoid treating the thigh, continue as normal. Massage is contraindicated, send the patient home. Avoid treating the thigh and entire lower extremities. Send the patient home and call their doctor to alert him or her of the condition. What do you guys think?
Avoid treating the thigh.
Avoid treating the thigh? Yeah. Yeah, it's this one. Avoid treating the thigh, continue as normal. You can see I chose the wrong one. Avoid treating the thigh and the lower extremities. There's an S there. which means I thought, okay, don't treat the thigh or the lower leg, like the shin, calves, foot. But it's the question that answer indicates both legs. So I would have gotten that wrong. Avoid treating the thigh, continue as normal. An open wound or sore is a local contraindication, meaning the therapist can safely perform massage to other areas of the body. Since the client has sustained no other injuries, the therapist can proceed with general massage as long as they avoid the open sore. It is not necessary to call the doctor or stop the massage. Since only one of the client's lower extremities is injured, the client can perform massage to their other leg. Okay, I have had two clients who came in with leg pain, and it turned out to be an infection. One was MRSA, which is really, really difficult to treat. It wasn't in her case, but it can be. So notice the question stipulates there are no signs of infection. What is that, 6 words? It changes everything, There are no signs of infection. So tell me, what are signs of infection? What are some of the signs of infection?
Inflammation.
Yes, inflammation. Now, what does inflammation mean? What does it look like?
Like
Flare up?
Like swelling? Definitely. And if something is swollen, what's different about its appearance? When we say it's swollen, your knee is swollen.
It's usually a different color depending on the person's skin tone.
Yes, it can be a different.
Yeah, and some of them are kind of hot if you put your hand close to it.
Right, hot, yeah. And also the size, right? It can be larger, like the skin can be distended and raised up away from the muscle or the joint or the area. So a sign of infection, what you kind of remember is, let's see. You can remember SHARP. SHARP as a good acronym for inflammation. And if you see inflammation with an open wound, for sure there's infection there, for sure. Like SHARP is swelling and then heat. Altered use, like they can't move it correctly. That one's kind of lame, but it's there, you know, something's swollen, it's stiff. If something's painful, they don't want to use it. And then R is redness, and then P is pain, swelling, heat, altered use, redness, and pain. That's an acronym for inflammation. Inflammation plus an open wound, there's infection there. And whatever you do, don't do consults by phone. Somebody says, oh, I've got this. Just in general, it's not a good idea to do consults by phone, right? Because if you can't see what you're looking at and you don't have the opportunity, and you know, you need that. Like visual inspection is part of your physical examination. That's how you see redness. That's how you see swelling. You can tell people that their condition is something that you usually treat, but you need to actually see them in person to do a complete exam. A client informs you that he is taking omeprazole, which is Prilosec, brand name Prilosec. What type of health problem is he most likely to have? Omeprazole, Prilosec. What type of health problem is he most likely to have? Cardiovascular, I'm sorry, I'm supposed to be leading this session. Cardiovascular, gastrointestinal, hormone, or respiratory? Which one?
I think cardio.
Yes, Ian. Prilosec. It's gastrointestinal. So Prilosec is actually for heartburn. Let's see. Yeah, it treats GERD, gastroesophageal reflux disease, classified as an anti-ulcer medication. Yeah, anti-ulcer medication, but it's used to treat GERD. That's like a secondary use. I think that may be an off-label use, right? So it's classified for one thing but used as another. Which position should be avoided for clients using decongestants? Which position should be avoided for clients who are using decongestants? Supine position, prone position, right sideline, or left sideline? What do you think?
Supine.
Supine?
Supine would be what? Face up or face down?
Face,
Face up.
I said
Face
prone.
up. Okay, so decongestant. Someone's taking a decongestant. What condition do they have that's making them take the decongestant? Why are they taking it? Marcos.
Should I go ahead and say it? Well, I would say a decongestant is more of like a respiratory, like congestion type of deal going on, right? So they're taking like these decongestants to loosen up the mucus and stuff. And yeah.
Yeah, congestion. Yeah. So what happens if you put someone face up who's congested? Where does the congestion go? No. If they're face up, it goes down into their sinuses, into their throat, and then into
Bro,
their
yeah,
GI
yeah.
system. But if you put them face down, where does it go? Then it goes into the sinuses. And the person can get, congested, maybe a headache, etc. Prone. The prone position should be
Oh,
avoided for
so it was prone.
prone, yeah. Supine, face up, carrying a bowl of soup. Prone to spill. Prone
Okay,
to
okay,
spill
I
in the
got
bowl
you.
of soup.
Yeah.
Yeah. So face down, prone.
That's confusing. I would have
Tell
definitely
me
thought
why.
supine. Well,
Because
because I feel like prone, they're laying down, so I feel like it would drip out their nose. You know what I mean?
yeah, yes,
That's why
yes,
I was like, for sure, supine.
yes. I think we need to look at the structure of the sinuses. So here we go. Okay. Okay, here's a sinus right here. Here's a sinus right here. And then there's these openings, right? I don't know the sinuses extremely well, but there's openings into the sinus, right? And there's an opening here. So the sinuses are reservoirs with one way in and out, I think. So think of the sinuses as like little areas where fluid can pool. So if it is logical what you're thinking, that the congestion, the mucus would just drip out of their nose. But if it's in the nasal, if it's in the nose and it starts to fill up, it will back up into the sinuses. And once it's in the sinuses, the pressure that it can cause above the eyes and under the eyes and around the nose, if it's severe enough in someone who tends to have like sinus headaches, they could be in a lot of pain. So, or if they have like chronic sinus infections, you will see people like that who have, cluster headaches or whatever, and they also have a history of like chronic sinus infections, and maybe they're going to get like surgery for it soon. One of the things Western medicine does when your immune system isn't working, they start boring out parts of your skull. And for a person like that, it's really crucial that you not allow that you not do anything to encourage the sinuses to fill up. But your thinking is sound, Larissa. It's just that the result of somebody being face up or face down is not quite clear. So if you put somebody face down who has sinus infection, who's taking decongestants, their sinuses could fill up, lay them supine, or on their right side or their left side. Best thing to do really is just to give them a choice. How do you want to be positioned? They'll know. I do not. They're not going to choose face down for sure. You guys want to keep going, or you want to take a break? Take a break. Oh, one of our crew wants to take a break, Sade. So we're going to take a break. Yeah. Okay. All right. All right. Okay, you guys come back in 10 minutes. That's at Eastern time, 7:36. Come back at 7:36. During an intake assessment, you learn that a client has a prescription for vasodilators. Vasodilators. Given only this information, which of the following conditions are they most likely to have? Okay, what does vaso refer to? Blood vessels or blood flow. And what about dilators? Dilation means
Okay.
to open. Yes. Given only this information, they're most likely to have what? Hypotension, hypertension, asthma, or anxiety.
I would say hypotension.
Okay. Anyone else?
Hypertension.
Yes, hypertension. Yes, for sure. So hypertension. So with hypotension, imagine a lumen or a tube, and imagine that the blood inside the tube is not adequate to fill it up. In other words, the tube is not full. The vessel is not full. If you open the vessel more in someone like that, what happens to the blood pressure? Does it fall even further, or does it come up and stabilize? It falls further. So they would give vasodilators. They would open the blood vessels to someone for whom the blood vessel is not only full, but also the blood vessels are constricting against the pressure of the fluid, or the fluid is pressing out against the blood vessel, however you want to say that. Okay, next, fill in the blank. A massage therapist sees a client who is taking analgesics. Remember, ana meaning away from or not, and then algesia or gesia, which refers to pain, anti-pain. During this session, the therapist should proceed with the massage as usual, since analgesics will have no effect on treatment, emphasize inflammatory techniques, and increase the pressure of techniques. Use more aggressive techniques since pain perception is reduced. Avoid inflammatory techniques and reduce the pressure of techniques. Proceed with the massage as usual since analgesics will have no effect. Emphasize inflammatory techniques and increase the pressure of techniques. Use more aggressive techniques. Avoid inflammatory techniques and reduce the pressure of techniques. So the answer should be reduce the pressure for sure. And the one that goes with that is avoid inflammatory techniques. Okay. Analgesics are pain relieving medications. They can be used in combination with massage to reduce pain. Over time, regular massage can reduce the client's need for those medications. Since these analgesics inhibit pain perception, the therapist must exercise caution to prevent injury and bruising. Because these medications reduce the perception of pain, it is appropriate to use, not appropriate to use aggressive techniques. The client will not be able to accurately say if the massage is too painful or aggressive, and these techniques can result in further pain and injury. Avoid inflammatory techniques and reduce the pressure of techniques. Okay, fill in the blanks. Fill in the blank. Blank are not classified as respiratory medications. Blank are not classified as respiratory medications. Antitussives, bronchodilators, antihistamines, or diuretics. Let's just check your like colloquial knowledge. An antitussive means what? And so tussive means coughing. Antitussive means stopping coughing. And then
Is the answer diuretic?
the answer is diuretic, yes. And then bronchodilator, broncho refers to bronchi, through the small features of the lungs which exchange gases. Dilation would be opening them. Antihistamine, stopping the histamine response. Often they also open the lungs, reduce phlegm, reduce swelling. And diuretics are Diuretics are medications which allow the higher, they make you pee. They allow higher passage of water from the body, right? So they can be very useful if you want to reduce blood pressure, for example, or swelling. But they're not classified as respiratory medications. They're normally used to treat high blood pressure. Okay. Narcotic medications are used to what? Prevent pregnancy, reduce inflammation, relieve pain, or regulate blood pressure. Narcotics are used to prevent pregnancy, reduce inflammation, relieve pain, or regulate blood pressure. Does anyone remember?
Pain.
And
Yeah, pain. Relieve pain. Yeah. And just a quick to touch on each category. Narcotics are used to relieve pain. They're a type of analgesic. Anti-inflammatory medications are used to reduce inflammation. Hormone medications are used to prevent pregnancy. Cardiovascular medications are used to regulate blood pressure. After injury, the inflammatory response is activated. Which of the following is not a sign of the inflammatory response? Remember, sharp. Is it bleeding? Is it heat? Is it swelling, or is it pain? Which one is not part of the inflammatory process? Bleeding, heat, swelling, or pain? Bleeding, that's right. Swelling, heat, altered use, redness, and pain. Sorry, I have to like scroll down and then, yeah. 4 signs of an inflammatory response include heat, redness, swelling, and pain. The 5th one is altered use, sharp. Okay, fill in the blank. Ibuprofen is not an over-the-counter medication. You guys know over-the-counter means you can buy it without a prescription from a doctor. Ibuprofen is not an NSAID, non-steroidal anti-inflammatory drug. An analgesic or an expectorant? Which one is it not? An expectorant, what's that do? Expectorates, helps you to cough up phlegm. What do we do to help people to expectorate? That's right, percussion. Tepotement. Fill in the blank. A therapist's client is on a blood clotting medication. As a result, the therapist should what? Perform the massage as usual. Always perform a deep tissue massage for this client. Provide deep pressure and aggressive techniques to break up tissue restrictions. Avoid methods that may cause bruising, including compression, friction, percussion, and skin rolling. Blood clotting medication. I think the answer is probably almost obvious. Avoid methods that may cause bruising, including compression, friction, percussion, and skin rolling. Anybody want to follow up on that? You all good with that? Okay. Fill in the blank. Disinfection is an aseptic method that what? Kills all pathogens, kills almost all pathogens, puts up a barrier against pathogens, stops the growth of most pathogens. The answer is that disinfection kills almost all pathogens, And here's an explanation for each one, which is good. So disinfection is an aseptic method that kills almost all pathogens, including hot soapy water and a 10% bleach solution. Those are the most common. Sterilization kills all pathogens in an area. Isolation puts up a barrier against pathogens. Antisepsis stops the growth of most pathogens. Okay, fill in the blank. A client's mood and behavior, excuse me, client's mood and behavior are most likely to be affected when they take medication to manage what? Mood and behavior. Circulation, dendrites, neurotransmitters, or peristalsis. It's kind of confusing. What do you guys think?
I'm gonna say neurotransmitters.
Yeah, I was gonna
Yes,
say that
exactly.
too.
Yes. Neurotransmitters for sure. Okay, so when medications are used to manage neurotransmitters, mood and behavior are affected. Change in neurotransmitter concentrations in various synapses. Raise your hand if you, or speak up if you don't know what a synapse is. Causes changes in behavior. Typical behavior and moods affected include the response to pain, the response to pleasure, and survival behaviors. Different people can respond in different ways to a decrease or increase in levels of neurotransmitters. Major neurotransmitters include acetylcholine, serotonin, histamine, epinephrine, dopamine, and norepinephrine. Dendrites are the branches of a neuron. Circulation is the flow of blood or other fluid through the body. Peristalsis is the contraction of smooth muscle, as in the digestive tract. Here's a couple more slides. A massage therapist begins seeing a client who has Parkinson's disease. The client takes regular medication for this condition. Given this, what is a potential side effect of massage for this client? Excessive drowsiness, dizziness, inability to relax, or bruising. Okay, this is kind of tricky, like truly tricky. Excessive drowsiness or dizziness. They should have omitted one of those. So according to them, according to the AMTA, it's excessive drowsiness is the better answer. Let's see if there's an explanation. The client is taking medication to correct the chemical imbalance of dopamine in their brain. For clients taking these types of drugs, massage often causes excessive drowsiness. It is important for a massage therapist to work under a doctor's supervision when treating clients with Parkinson's. Dizziness is a potential side effect of massage for clients taking a variety of medications, including beta blockers and antihypertensives. Bruising is especially relevant when working with patients on anticoagulants or blood thinners. Clients using central nervous system medications may have a hard time relaxing. However, this is not a direct result of massage. Okay, so this is important. So they're associating dizziness more with beta blockers and antihypertensives. So like high blood pressure medication and beta blockers. They're associating dizziness with that more than medications that treat Parkinson's disease. So you have to keep that in mind. And excessive drowsiness more with Parkinson's disease. Is that it? I think that might. Yeah. Okay, so we have a few minutes left. Are there any questions about medications so far? No, no questions. Okay, good. They mentioned dendrites. Has anyone looked at the nervous system video that I made and posted for you guys?
Is that the last one that you just posted?
No, second to the last one. No, third, no, it isn't. Okay, so let me hide these meeting controls. And let me see which, so you guys see what I'm watching on YouTube here. It's not really the smartest thing for me to just go pulling that up, right? So where's the account? It's under hypothalamus and pituitary. So the hypothalamus and the pituitary video starts with the brain. And the reason I started with the brain is because the hypothalamus.
Nerves are built with a nerve body.
The hypothalamus is part of the brain, and it regulates the endocrine system. So it's the link. considered the link between the nervous system and the endocrine system. And it's the top of the endocrine system. So, yeah. So dendrites are these structures here. So here we have a nerve cell. Let me back up a little bit so that there's not like two nerve cells. There's one on the left, one on the right. Here's one nerve cell, one neuron. So here's the body, and there's the axon with the axon terminal that looks like dendrites. And then up here, these are dendrites as well. These are dendrites as well. These are called dendrites on the body of the neuron. Inside the neuron body, neuronal body, nerve cell body, you have all the same features, all the same organelles that exist in other cells. So you have a nucleus, and you have endoplasmic reticulum, smooth and rough endoplasmic reticulum. You have ribosomes, mitochondria. You have cytoplasm, right? You have DNA in there. You have a cell wall that's typical of all cell walls. It's made of like lipids and carbohydrates. It has like little protein gates in there that let structures in and out, that let things in and out, charged ions or other particles, mostly charged ions like chloride, sodium, potassium, and calcium. What else do I want you to know? Oh, okay, and also on many nerves, mostly those which are white in color. So the brain can have white matter and it can have gray matter. And the white matter is white because it has these fatty sheaths wrapping around it. The sheaths are actually alive. They're actually called Schwann cells or Schwann cells. And the job of the Schwann cells is to insulate the axon. The axon's like the long wire inside the electrical wires. And what the axon does is it conducts the movement of electricity, the movement of a nerve impulse, the movement of an action potential. Those are all the same thing. An action potential is a nerve impulse, is an axonal impulse, is a electrical impulse, a nerve impulse. Those are all the same thing. And the job of the myelin sheath. So this is a crude drawing of a Schwann cell that's wrapping around the axon, and it doesn't wrap continuously. It wraps in spots, right, at regular intervals. And the job is to insulate, and an insulator prevents the movement of electricity, the movement of heat, right? Prevents it from leaking out. So you can think of these places as areas where it quickens the movement of the action potential. So an action potential that moves through an axon that is myelinated, that has fatty myelin wrapped around it at regular intervals, will go faster. It sort of skips over the myelin sections, making the net total of the axon shorter. It's important, myelin. You will see clients who have defects in myelination or don't have enough myelination, sometimes genetic, sometimes as a result of a disease, multiple sclerosis, or undiagnosed diseases of the nervous system. Sometimes through dietary sources, a lack of fat can cause a decrease in myelin. Like an extremely low fat diet. There was a fad in like the 80s and 90s that was like really, really super low fat, no fat. And a lot of people did have deficiencies of myelin and didn't have fast enough nerve transmission. Slow cognitive thinking, slow reflexes, numbness and tingling in weird places that would migrate, numbness and tingling in the hands one day, in the face another day, in the torso, and the feet, second, third days, just like spontaneously forgetting stuff. Another time, another dietary cause of lack of myelination is NutraSweet. What's the name for NutraSweet? NutraSweet is a brand name. What's the chemical name? It's aspartame. Aspartame poisoning. It causes multiple sclerosis-like symptoms. because one thing that it does is it breaks down the myelin in the body. Montel Williams has that, and he blames his multiple sclerosis on his consumption of aspartame drinks. Okay, what else? So the area where two nerve cells, new phrase. So the area where nerve cell bodies meet and they gather, that area is called a nucleus inside the brain. Outside the nervous system, outside the central nervous system and the peripheral nervous system inside the body, it's called a plexus, a nerve plexus. So you have a nucleus, like in the hypothalamus, you have like several nuclei where all these nerve bodies gather, and they all share dendrites, and they share dendrites and axon terminals. And the reason they do that is so they can exchange information. And lots of nerve cell bodies getting together are necessary to manufacture things like hormones and neurotransmitters in adequate enough amounts to manufacture things like acetylcholine or dopamine, or antidiuretic hormone. If it were up to just one nerve cell, that would be quite a pull. So they get together, and they're called nuclei in the central nervous system. And then apparently I have a myelination deficiency. And then what are they called in the peripheral nervous system? Nuclei in the central nervous system, and plexuses in the peripheral nervous system. Okay, guys, if you haven't listened, I think that's our time for tonight. Yeah, if you guys haven't listened to this wonderful video, give it a listen. It's really, really good. It's much better organized than the nervous system and endocrine lecture that I gave you on the first night. I spent like almost 2 weeks, I think, organizing this, doing drawings and getting it down to like under 20 minutes. Hopefully it's something you can listen to over and over again until you don't need it. You have the knowledge and you don't need it. All right, guys, great work as always. Whatever holiday you celebrate, have a great holiday. I hope you have like time with your family and time off to chill. You'll get a copy of the video, and also it'll be posted to YouTube, and I'll see you guys on Monday.
Yes, sir. Thank you, Kim.
Well rested, bright-eyed, bushy-tailed. Okay, guys, take it easy.
Thanks, Kim.
All right, my
Holiday.
pleasure as always. Have a good holiday.